Hi everyone, my name is Pelia Rustemas. I'm a registered nurse with Select Specialty Hospital in Grosse Pointe, Michigan. My evidence-based project is on preventing pressure injuries in a critical care setting. This is for University of Kentucky, Nursing 463-201. So like I mentioned, I work at Select Specialty Hospital in Grosse Pointe, Michigan. Select Specialty Hospital is a 26-bed unit that's housed inside of Ascension St. John Medical Center. We used to be called an LTAC, Long-Term Acute Care. We are now switching to a different name, CIRH, Critical Intensive Recovery Hospital. Next couple slides, I'll show you a few pictures of some rooms on our unit. One patient bathroom, the other one is a patient room, and then the other one is of the front desk area nursing station. Next slide, I have a picture of the PT/OT room, which also shares a space with our speech language pathologist. Sometimes patients will be able to make it in there to do therapy if they're well enough. Other times PT/OT sees the patient at the bedside, usually anywhere from 3 to 5 times per week. Next picture is of our conference room / multi-purpose room. We use it for meetings, orientation. Prior to COVID, we used to host gatherings, like our big Christmas party was in there. It was great. We're hoping to get back to that someday. The overall learning goal of this project was I wanted the staff to learn the importance of how to decrease pressure injuries with the main focus on floating heels. And just a little background on that, earlier in the year, we had 2 patients that developed pressure injuries on their heels when they didn't have them upon admission. So the main goal was for us to make sure that heels were floated and that was not to be an occurrence again. A few learning objectives I had set out was for the nursing staff to identify risk factors for developing a pressure ulcer by the end of practicum, and to evaluate the assessment measures and procedures by the nursing staff by the end of practicum, and apply effective techniques for repositioning and offloading that would be demonstrated by the nursing staff by the end of practicum. Again, the focus more on offloading the heels. So here's some points I put about the project idea. I wanted to develop educational materials to educate the staff on how to prevent pressure injuries, educate the nursing staff on the importance of floating heels, mobility, and turning patients. And we do every 2 hours, pretty much like every other facility. I wanted to educate the staff on the time frames that is required by our hospital policy for patients to have an initial skin assessment, and how often that reassessment needs to be done. And I also wanted to encourage the staff to attend monthly wound care committee meetings. We recently formed a wound care committee, my preceptor and I, shortly after these pressure injuries were discovered on the 2 patients. I did a comparison of a couple of literature items I found, and both of them were similar, and what's kind of shocking was pressure injuries of the skin and soft tissue affect approximately 1 to 3 million people in the US every year. I'm pretty sure many of you are familiar with this, the Braden scale, which is used for predicting pressure sore risk. So the Braden scale is performed by the nurse upon admission and then weekly, and in between that time, if anything changes with the patient's status, good or bad, we have to change the Braden scale as well.
This next slide.
So here I wanted to show a picture of common sites of associated with pressure-induced injury from Lovegrove et al., a global meta-analysis from 2008 to 2018 determined that approximately 64% of pressure injuries happened in the hospital. So my area of focus is the calcaneus. This is a sheet I just wanted to show, part of our protocol for wound care, prevention of HAPIs and worsening wounds. It goes through some basics. Primarily, it talks about how the skin needs to be assessed by the nurse within 8 hours of admission, and focusing on nurse and SENA communication. It also mentions about when wound care is not documented properly or dressing is not labeled, that, or if it was never done, then that's considered an incident report. What I wanted to touch briefly upon, one of the items that a representative from Frontier Therapeutics came by and showed us was the repose system. This is one item that is on our formulary, and I already took it out of the packaging, which is this great tube, which is also the inflator. So the repose has a tacky side and a smoother side, and this is for help in offloading the heels. Also has a strap that goes underneath the bed. But basically what you would do is you attach this part to the end of the tube, and it goes on pretty easily. And then it just takes a little bit of time to pump up. But what is great about the repose is that it also protects the knee. A lot of times we either offload the heels on a pillow or a boot, but the boots sometimes get warm and they don't really offer support for the knee and to where the knee could form a contracture. So this is a great device. I said tacky side, smoother side, and the bare skin can lay on this. You don't need any other supportive material underneath, and then this goes underneath the knee, and then the heel would hang over this. So we've been using that lately to help reduce pressure injuries. Next, I just wanted to show an analysis of some pressure redistribution properties of different air and foam cushions that this product designer from Frontier Medical Group, a study that he did. This is an example of an audit, a floated heels audit that we did. So we asked a SENA or a nurse to do 8 random room audits, and just let us know if the heels were floated or not. And then if they weren't, then they would have to report those off to the charge nurse and let us know as well. It says on the bottom 10 room audits, my preceptor and I did the other 2. Here's a pressure injury prevention crossword puzzle that I'm going to present to my coworkers at our next wound care committee, which will be at the end of the month. Just something fun, some fun learning material. And lastly, I just wanted to say thank you. Thank you for listening to my presentation. This clinical experience has been quite an eventful one. I started out with my preceptor, who is a wonderful wound care nurse. I acquired so much knowledge from her in a short period of time. And while she was on vacation, in fact, prior to her going on vacation, she trained me, and I was able to cover for her, and her role, and I saw her patients. In the midst of all that, I was also working in the quality management department, so I was doing both jobs simultaneously, and many times it was challenging, and doing both jobs, but thankfully I did not give up. Below is a favorite quote of mine. It is from Atticus. You never really understand a person until you consider things from his point of view. until you climb into his skin and walk around in it. Walking in the wound care nurse role for over a week helped me to understand the role much better, helped me understand the complexities of it, and realize that there's so much more to learn, a lot more. And my preceptor recently resigned abruptly a couple of weeks ago for some known and some unknown reasons. But that's okay. I'm grateful to her for the learning experience that she gave me and that I continue to grow upon at this moment. I'm still going to conduct the wound care committee meetings, and I'm still helping out with the wound care rounds with the doctor that rounds every week with us in the interim until they find a new wound care nurse. But on the plus side, since we started the heel audits and reinforcing the importance of floating heels, we have not had a reported pressure injury since the last two. And even on a better note, the last two pressure injuries that occurred, those ended up healing again. So that was good on our part. And I hope that we can continue that streak. Again, thank you for listening to my presentation. I hope you were able to learn a little something from it. And best of luck to everyone in their future pursuits.